Well, good evening, everyone. Welcome to Nurse Charms Live, and we are live. First off, this is a little different format than what I've usually been doing. This is going to be today. We're doing a symposium format, so I actually have a panel with me. So I'm so excited. I'm going to be introducing them in just a minute. But before we get started, just kind of take some time to do my little housekeeping. First off, please share this video. This is going to be some good informative content tonight. So please share this video, whatever you're doing, start right now. Share this video, whether you're on Facebook, YouTube, get everyone to watch this video. Okay, so that's awesome. And second, everyone on my panel are healthcare providers, but this doesn't replace the information that you will receive from your doctor. So if you have any further questions after watching our symposium, please follow up with your primary care physician. Okay, that's the disclaimer I want to put out there. But other than that, let's just go ahead and get started. Everybody knows me. I'm Nurse Charm. So thank you to all of my supporters for being here with me tonight. We're going to be talking about the impact of COVID-19 and mental health. So is COVID-19 affecting our mental health? And in honor of Black History Month, that's really why I wanted to address this, this topic. And we're going to get into more why we're talking about that in just one moment. But first, we have Dr. Michelle Lino, who's joining us. Hi, Dr. Lino.
Hi.
And
thank you.
She's an accomplished psychiatrist, and she has her own practice. She also has a psychologist. I'm sorry. She's an accomplished psychologist. She has her own TV show Saturdays at 11 a.m., right?
11:30.
Saturdays at 11 a.m.
on TV.
11:30. Okay. Okay. Yes. Thank you. And then we also have Crystal Brooks. She's a nurse entrepreneur. She's also actively practicing as a registered nurse right now. She has leadership management background. She has a psychiatry background. So just kind of giving out everyone's street creds. And then we have Andre Ash, who is an accomplished journalist, and he's going to be our moderator this evening. And I'm so excited to have my panel and my moderators. So with that being said, let's just go ahead and get started. Oh, real quick, we're just going to go through Andre is going to ask the panel questions. And then if you all have any questions, you can go ahead and comment on our comment program. We'll make sure that we address any comments that you have or any questions that you have. Okay, so let's go ahead and get started.
All right, so good evening, everybody. My name is Andre Ash, and we can tell that Nurse Charms is very excited about today's virtual symposium, as well as our expert panel of guests this evening. So let's get straight to it, because we know that COVID-19 affects African Americans disproportionately as it relates to infection cases, hospitalizations, death rates, due to the disparities to access when it comes to medical care. Also, we know that there are economic inequalities due to job losses, health insurance, and lots of other things that have created a safety net before the COVID-19 pandemic hit. So we're going to get straight to our first question of the night. And again, we appreciate everybody for joining us, presented by Nurse Charms Live. Again, leave your questions and comments in the comment section, and we'll get to them throughout the show. But first, let's start off with the first question for tonight. What is the significance of having this conversation today as it relates to African Americans? And I'll throw that question first to our registered nurse, Selena. What do you think is the importance of this conversation that we're having tonight as it relates to African Americans, and why should people adhere to, we talk about mental health, and there's a stigma that relates to it, but certainly COVID-19 has impacted all of us, and certainly mental plays a big part of that.
Absolutely. Mental health plays a big part of it in our community. I would say for a nurse, a provider in mental health at the time, it really affected our population really heavily. But I do believe that through education and also
Wait,
through this.
one second. I'm sorry, Crystal, to cut you off. You're sounding a little choppy right now. Do you have full connection there?
Yes, I do.
Yeah, I'm hearing it
Okay.
too. And I was checking to see if it was making sure it wasn't my internet because no one else said anything. But I saw your face, Charmaine. So
Okay.
yeah.
Do you think
So,
can you start over, Crystal? Because I think.
well, what
Go
about,
ahead.
and what will also probably help too is for if we can keep our mics off until we all speak.
Okay.
That may help with
Okay.
the connection if we can turn our mics off and then leave it to the person who has the mic to speak.
Can you guys hear me now? Is that better? Okay, great. Well, as a registered nurse and also as a nurse leader, during the during the COVID pandemic, it has been extremely challenging, especially when it comes to the mental health population. But we have gotten through this through education, through a lot of support from the community, also from just getting together and getting down to the patients, seeing their needs and addressing those needs and those concerns, and also updating them and educating them on what expectations, and also just letting them know what's going on. When the mental health when the pandemic started, a lot of our patients were in the hospital. That's when I was over a mental health area, and they heard about what was going on the outside as it related to COVID-19, but a lot of them hadn't been out in the community, so they didn't know what to expect. So again, we just educated them and taught them how to protect themselves, against the in the disease process, and that's how we were able to manage and get through it to this point, through education, just constant education, constant reassurance, and just giving them what they needed.
I want to get Dr. Michelle Lino to jump in here on this discussion because we know that Black Americans with pre-existing mental illnesses are the most vulnerable for all of these reasons, such as stresses, losses, an increased risk for depression, anxiety, substance abuse, suicide, and poor physical health. And what's interesting, though, is that remember during the early stages around this time when everything was shutting down last year, and the primary care that hospitals would give would be to treat COVID-19 patients. Meanwhile, other health issues, as I just mentioned, had to be sidelined. And part of that is depression and the other mental illnesses that were being left unaddressed. Where do you believe the type of conversation that need to be had and what needs to be addressed when it comes to mental illness for African Americans pre-COVID-19 and even in the midst of COVID-19?
Well, Andre, I'm glad you asked that. And as Crystal said, people have questions and they're looking to us to provide answers. But, this just speaks to the problems that we already had in terms of acknowledging mental health conditions. I mean, when people think of mental illness, they think of weak. They think of somebody who, you see movies, you see where people are like strapped to a bed. They think of worst case scenario. They don't think of the person, of the business owners. They don't think of the athletes. They don't think of the entertainers that are, going to work every day and dealing with their issues. And so you have a system who's not willing to really acknowledge it, although it has gotten better, I will say that. So when you have a system that's not acknowledging it much, and then you have people who are resistant to even acknowledging that there's a problem, then you end up with, just the worst case scenario where we are in this pandemic. And, if I already have anxiety, now I have more anxiety because, I can't even do the things that I would usually do to cope. because, you know, I'm not seeing my friends as much. I'm not seeing my family as much. And then you're asking me to just isolate on top of all of that. So how do I really get through that? So the positive side of COVID is that it got us to look at, you know, there's more to health conditions than just what's happening in our physical bodies. There's more than just, you know, taking a pill for hypertension or to manage your cholesterol. We have to manage here, because when you manage this, then everything else gets better. You can cope with maybe being in the house for 6 months and you deal with it a little bit better, although you might still feel like, okay, I'm losing it, but you find ways to deal with it. So that's why it's so important that we're having these conversations, because we're normalizing. The more we hear depression, anxiety, the more normal it becomes. It's not that best kept secret that people are like, something's wrong with me, but I don't know what it is. So I think this conversation is important because we're normalizing what happens to maybe even all of us.
Yeah, and you know what? You talk about isolation and, you know, we've all had to social distance and work from home and do lots of things from home these days over the past year or so. Even this session we're having right now, you know, it's virtual. We're not all together gathered and having this conversation, but nonetheless, we're having it. Nurse Charms, talk to us about some of the things you've experienced firsthand, because we know that you have a nurse background as well, and even bringing together this conversation virtually. I mean, who knew we would have had to go through a year of, I don't know how many times I've heard the word Zoom, but there's been so many Zoom meetings, virtual gatherings, such as the one we're having tonight. Talk to me your perspective about this conversation, and why highlighting it is so important to you.
Yes, absolutely. Well, you know, I have a massage business, so I am the go-to person for anyone who's dealing with stress. And we all know that this COVID-19 pandemic has caused so many people stress, regardless of, you know, the financial impact it's had, you know, people, jobs downsizing and them just being out of work. So it's like, now how am I going to pay my bills? You know, just losing family members. And, you know, that in the Black community, it's like we're already at a disproportionate risk of catching COVID. And then on top of that, you know, Black Americans who already have pre-existing, you know, mental health disorders. So it's like, add those things together and it just becomes, you know, one recipe, you know, just for stress. So it's like, just basically supporting that person, you know, allowing them to, you know, just open up and just share whatever it is that's on their mind, you know, letting them know that, you know, it's okay to feel anxious, it's okay, you know, if you're dealing with any type of mental illnesses right now, you know, just basically supporting and encouraging that person, you know, and giving them resources, you know, who turn to, you know, for support. But yes, I've definitely been witnessing, you know, several people just going through some form of mental illness. And, you know, there's such a stigma with it, which, you know, we'll probably get into that later. But so yeah, that's what I'm seeing right now.
Yeah, let's talk about we'll get into the stigma, but just a few facts related to COVID-19 and mental illness. You know, first, of course, when we've been talking about this, we'll have to address the stigma that and the marginalization that happens in the Black community related to mental illness. You know, there's, you know, I know some people have had to go out into the workplace, and some workplaces, they offer COVID-19 testing on site. And I know with a couple of friends I was speaking with in their workplace, it is sort of that, oh, I don't need to take a test for that, because there still is that stigma of, you know, we're Supergirl, Superman, and that, you know, as long as I'm breathing and living and, you know, walking, I don't, you know, we're seeing as some people invincible to COVID-19, even when it comes to just taking a test. But let's get to some of the facts here. Black Americans represent a large percentage of essential workers and have the highest risk of exposure to COVID. They utilize the public transportation system to get to work, etc. And a lot of Black Americans have also experienced personal impact of death when it comes to family members, and in addition to the isolation and the lockdowns. And I think the question that we want to get to tonight, our second question, is how do the fears of being infected with COVID-19 play a role in the mental health status of African Americans, that fear of getting COVID-19? Let's go back to registered nurse Selena Dallas, excuse me. I'm sorry, registered nurse Crystal Brooks, I'm sorry.
That's okay. Well, as it comes down to a fear, what I have actually seen is kind of like the opposite in mental health. I've seen the majority of the mental health individuals that I've come across, they pretty much have a stigma to where they don't feel like they can catch COVID. So we have to really protect them, because you think that you're talking about the mental ill. So they have this this thought process, some of them, that this is not real, it can't happen to me. So with those individuals, we have to protect them, and we have to again educate them to let them know that this is real, this can happen to you. You need to be safe, you need to wear your mask, you need to socially distance, wash your hands, use your hand sanitizer between washing your hands. So that's what I have seen from a mental health perspective, as during the patients that I deal with, is that we have to protect them, because we know that they're the most vulnerable, because of their mental illness. They have to be protected. So that's what I have seen in the mental health community.
And what's interesting is we're talking about the fear of catching COVID-19 and how that plays into the health status of African Americans. That's the question. So that fear that people have. Let's get to that, because today the governor here in Michigan, Governor Gresham Whitmer, announced that in the coming days we could be likely nearing the possibility of opening up the state even more. We're already under a certain phase of, certain bars and restaurants can be opening to a certain time frame, and also our restaurants in general being open to in-person dining. But now with the announcement today that even more things could be opened up within the state, slowly returning back to normal, Dr. Michelle Lino, that fear that people have after months of being kind of sat to the sideline at home, and now people getting back together, possibly more things opening, that fear could become a larger question. Dr. Michelle Lino, what says you?
So that fear, fear is real. Think about any time you're dealing with fear. A fear starts, it could start as something small, and then it just takes over. I mean, your imagination starts, running all over the place. We're back to that worst case scenario. And so fear related to catching COVID, or just fear related to, what has happened to other people around you, it could affect us in so many different ways. First of all, it could cause us to miss out on opportunities, because just as things are reopening and people are taking advantage of some of the services that are now being offered, people are returning to work. Well, if you're fearful of catching this virus, you may not return to work, because that fear is just that powerful that it causes you to disregard why you do need to return to work, maybe for to pay your bills. I would say that's usually like the number one. So it could cause us to become stagnant, because we stop looking at the facts. We stop thinking of ways that we can protect ourselves, because really I see that this is about us protecting ourselves, right? It's about, we have to practice the hand washing. Rationally we know that, so we're practicing these things. We're taking these steps to keep ourselves healthy. And really some of these things we should be doing in the first place. We need to get out more. We need to move more. This is not the time to just freeze and not do anything. This is the time, if we're in a health crisis where we're having something that can potentially affect our immune systems, our abilities to heal, that's the time when we need to get our health in order. So when we're doing that, when that fear could cause us to do just the opposite of that. It could cause us to isolate. I mean, staying in the house all day, every day, doing nothing, not being around people, that's not healthy. So fear could cause.
Well, not just being in the house, not just being in the house all day doing nothing. I mean, some of us have been eating, eating too much.
We need that sometimes because we need some downtime, right? We need some of that downtime, but to do that all the time because I'm afraid to go outside because something bad might happen, that is like very, very dangerous. And that's so bad for our mental health, because what happens when we avoid those things that we fear, then it becomes a bigger monster. You know, the monster ends up under the bed and it doesn't go away because we're trying to avoid it. It ends up getting closer to us. So actually, the more we approach the so-called monster, the smaller it becomes. So that's how fear kind of stops us from that growth that we need as human beings.
And I'll circle back to our registered nurse Crystal Brooks in just a moment, because I want to ask this to Nurse Charms as well about fear in this mindset. Being a nurse and working, I mean, first of all, you're an essential worker as long as in a pandemic we have to go out and face this current pandemic that we're in. But talk about the fear, Nurse Charms, of your time as a registered nurse working in a hospital facility where, you know, pre-COVID-19, you know, were there any personal fears of just working in that setting, not knowing, because you're a hero to many patients. You've been a hero to many patients. So has there been like ever a fear of, like, before COVID-19, like of encountering and putting, I mean, you put your health at risk before COVID-19, right? So what has the fear factor been like for you? And speak to it, how it's certainly probably a level of fear for a lot of other health professionals, especially in the hospital setting, dealing with COVID-19 patients. And first, let's get your mic on, Nurse Charms.
Okay. Here. Okay. This is better. Sorry about that. I'm just talking away. Okay. So first off, I think everyone had, you know, fear when this initially you know, hit us. You know, the United States is like, oh my gosh, nobody wants to pick, right? And that people, you know, are dying. We're getting all these stuff on social media, you know, what's going on in China. So yes, absolutely. You know, I just wanted to hunker down and not go anywhere around anyone. But research came out, you know, we learned that you know, people were surviving. We learned the populations that were at the highest risk for COVID. So that released, you know, a lot of my anxiety. Then just educate myself more on the disease and, you know, how it spread. I mean, for the most part, you can manage through the disease distancing. Of course, you know, everything that can help reduce your chance of spreading it, you know, hand sanitation and all those things. But, you know, just making sure you're not around anybody sick. But then, you know, we have the asymptomatic spread of the disease. So, you know, really just kind of taking precautions and, you know, people just need to be honest, because there are cases where some people just, you know, reckless out here, knew that they had the virus. So just really taking precautions. And in terms of fear right now, like my anxiety about the disease has decreased significantly. That's been helping to keep, you know, some of my fear down. But I'm one of those people is like, okay, enough is enough. We gotta, you know, manage through with this thing. So you know, it's time to get vaccines. You know, it's time to open up businesses, or our economy is just going to be destroyed. So, you know, as we've been, I think just always be mindful that you can always catch this disease. You know, nobody's invincible from it. So continue to take your precautions. I think the smart thing to do would be to get, you know, not trying to force my opinion on anybody. But, you know, that would be the smart thing for more of us to get the vaccine, especially if we're high risk, and, you know, continue to do those healthcare behaviors. But yeah, I know there's still some people who are, even with the vaccine, they don't want it, want to go out, but you can't live your life like that. So at some point, you got to kind of make the decision. I mean, it's like if you were to catch any other disease. That's how I feel.
No, I want to bring registered nurse Crystal Brooks in for a moment, because I asked you the same question, Nurse Charms. You know, being a registered nurse and being on, I mean, you're on the front line of this current pandemic that we've been in. But talk to me personally about the fear for you. I mean, because certainly you're exposed to a lot of different, you know, health concerns of patients that, you know, you encounter. What is the personal fear like for you, if any, when it comes to being on the front line dealing with this firsthand?
Well, you have a care from the care perspective of you know, bringing it home to you know, so
Let me pause for just once. Let me just pause it for 1 second. There we go. We just want to make sure the mics are cleared on all of our parts. Go right ahead.
Okay. I've been a nurse for almost 20 years, and I will say that I have faced a lot of issues with infection and disease processes. But with this particular pandemic, the concern is bringing it home to your family members that are compromised, and what it can do to your family members that are compromised. That is the biggest concern for healthcare providers. So with that being said, just us being educated and us using the extreme forms of PPE that we can, you know, and be as safe as possible. Universal precautions, hand hygiene, cannot stress that enough. And using the proper PPE when you're caring for those patients that have COVID, or that even could have COVID, you know. And if you use the PPE as it's been intended to use, then that reduces your risk. And of course, you know, you have to go and get the vaccine. Like me, I've had my vaccine 1 and vaccine 2. So whatever is recommended by the CDC for me to protect myself and my family, and also the patients that I care for, I will do that. And I strongly recommend that my counterparts do the same thing, because that's how we protect our family members, the community, and all the patients that we care for. But yeah, it is a fear. But you know, we're heroes, and we have to be strong, and we have to go at this and care for the most vulnerable. That's what we, you know, did our oath for. We made an oath that we would do that, and so this is what we're doing at this point.
Well, I think this COVID-19 has highlighted health in more ways than one. The importance of health, when you talk about immediate health on the front lines, you know, for doctors and nurses at hospital facilities, but then also health in going to a psychiatrist to address mental health. Both sides of the care are important. But now let's dive deeper into the stigma of the symptoms. The symptoms in the Black community there is, and how that creates obstacles for mental health. You know, next, I want to go into the conversation about how Black Americans have traditionally distrusted, have had distrust in physicians and vaccinations. So let's talk about that. we see how doctors and nurses in our healthcare facilities have been vital heroes, but then the effects of COVID-19 that have kept us trapped and have done something to our mental health. But then even before COVID-19, you back that up. Well, Black Americans, we've always had distrust in doctors and vaccinations. And now you're telling us that during the pandemic, we are to trust these very same institutions or methods or professions for our care when we have distrusted them before we ever knew anything about a COVID-19. Dr. Michelle Lino, what says you?
Well, I'll say, yeah, we certainly have had this, this fear traditionally of going to the doctor. And most of the time, I mean, that fear comes from people just don't want to hear bad news. I mean, I think that can be simplified, but I'll speak for myself. I've always been one to have my regular checkups. I'm really into holistic medicine also. So I do a lot of that. I do acupuncture. I have a holistic chiropractor. Now, the vaccine, I am probably in the minority, as far as on this panel right now, because I have not had the vaccine and I have not made a decision to get the vaccine. But that said, I would not talk anybody out of it. I do think it's something that is a personal decision, but I always say, no matter what you do, you have to figure out a way to take care of yourself. It's not enough to just say, I'm not getting the vaccine. You still have to figure out ways to manage your health, because that's what's the most important. And so however it is that you manage your health, you need to figure that out. You also, you need to have regular checkups. You need to make sure you're doing something that you can say, okay, I know, what my numbers are in every area. It's not just a matter of getting a COVID test. I know that that's the primary focus right now, but there are we have to make sure our vitals are in order all the time, because if we make sure we're healthy and we do contract, a deadly infection, we're more likely to survive it if we're already in good working condition. So, I think the fear just comes from, it's traditional. We don't like bad news. And I don't think that fear is limited to Black Americans. I think we may be more vocal about it. I think we may know more family members, of a certain age that maybe didn't go to the doctor for 20 years even. But it is something, I don't think that part just affects us. And you think too, sometimes people go to the doctors and they're desperate for an answer and desperate for healing, and they don't always get the outcome that they're looking for. So that right there kind of reinforces that behavior of, okay, I'm just not going to do any of it. Let me just figure out something else, or not. Or sometimes it just comes down to not doing anything at all, which is definitely not the answer. You always have to do something. So I always say with my clients, if you're not going to do this, okay, let's talk about what you're going to do, because we have to have something on the table.
Yeah, and we know that health insurance plays a part of it for African Americans. We know that, like you said, the fear of hearing bad news, and heck, for me, it's well, I think I've gotten over it a little bit, but for some people, it's even the look, the hospital kind of setting, just the very look of a hospital. But nonetheless, Nurse Crystal Brooks, you're a woman, you're a Black woman, and you work in healthcare. How do you convince other Black Americans to trust the very profession that you're a part of to get through this pandemic, and trusting physicians like yourself and vaccination?
Well, I educate. I actually had one of the CEOs, not the CEO, I'm sorry, but the CNO of one of the healthcare organizations that I work for. And I partnered with her to do a campaign for some of the community members and also the members of my church, because I'm also a pastor's wife. And I had her to come on, and I had her to explain what is COVID-19 doing in our community? And we explained that from a professional standpoint. We explained that The first vaccine that you get protects you 75%, and then the second, the research shows that it protects you 96% from getting those um, those disease processes that end you up on the ventilator and will lead to demise. And if you're in that 4% that just happen to catch COVID, then they said it won't be till death. That is what the research is showing. So we explained this to the individuals, and we also opened up an opportunity. Well, she was so beautiful and nice enough to open up an opportunity to immunize 65 and over. Anyone in the congregation 65 and over that will come to the hospital and get immunized. And we had a lot to come in. I mean, they were afraid. And we sat down, we educated them, and I even showed a video of me getting my vaccine myself. I showed a video getting my first, I showed a video getting my second. I'm like, if I can do it, you can too. I have children, I have a husband, I have, elderly people in my family, and I'm trying to protect them. So this is why I'm doing this. So I believe through education and setting that example and setting that standard, I believe that you can pull more of those individuals that were, saying, I don't think this is for me. I don't trust it. I don't think that that's something that I should be doing. You have to continue to educate, continue to show that example. And I believe that we can kind of pull those ones in that have those trust issues.
Yeah, and just getting people more engaged and informed like we're doing right here, right now. And we want to invite people who are watching or listening that if you have questions that you'd like to ask our panel of guests, you can do so by making your comments in the YouTube section. I know Nurse Charms wants to get to some of those questions. So for people who are watching and listening to us live right now on YouTube, Nurse Charms Live, we invite you to bring your questions or comments into our format tonight. I want to get to Nurse Charms in just a moment, but I also want to get to this question. So we've outlined some of the issues in the Black community, and actually before that, we were talking about vaccinations, and we know that one of the pioneers for the vaccines is a Black woman. So kudos there. But let's get to some of the outlined issues we talked about in the Black community, and where do we go from here? As all of you on a panel who are providers, what outcomes do you want to see? Let's talk about mental health reform, and then we'll also get to continued education about the pandemic as well. But as far as what do you like to see, particularly on health policy reform, mental health policy reform? Nurse Charms, let's get to you.
Okay. All right, there you go. All right, yes. Mental health forum monies. Fortunately, some of our institutions were shut down because there just wasn't funding to keep them open. So we definitely need, governmental monies to be poured into the communities so we can offer resources for those who are experiencing, mental health issues. One of the things that the pandemic, unfortunately, did, it limited access for people to have, access to their providers. And then a lot of people, especially in like the underserved communities, especially downtown in Detroit area, people don't have Wi-Fi. You have to be able to afford a cable bill or at least a cell phone. Some of those people don't have those. So how some of the healthcare providers transition Zoom, that doesn't help everybody. That helps the people who have connection, but it doesn't do anything for those who don't. So just resources for people, monies, for just hiring more into public health providers, and just centers and facilities that can actually take care of these people. So some reform that's gonna provide solutions. I'm sure the rest of the panel will education, because then it kind of ties back to when we were talking about the stigma, you know, just making people feel comfortable that they can come. Is you know, within the Black community, you're dealing with, you know, the increased risk for them to be exposed to COVID, die from COVID potentially, and then on top of that, their pre-existing mental conditions. So definitely a disproportionate risk, and, you know, need to make some improvements in mental health reform.
Yeah, and again, you know, all of you here on the panel are providers, healthcare providers. So the question we're asking is, what outcomes would you like to see, and particularly when it comes to mental policy or mental health policy reform? Just a little news and politics in some of this. We know that the federal government is proposing from the White House a $1.9 trillion COVID-19 relief package that will go towards, of course, the funding for medical supplies and for, you know, to our hospitals and for vaccine distribution, but not a lot of conversation is being had about mental health related to COVID-19. I mean, we see the effects, you know, kids not in school, and they're not socializing with their, you know, their classmates, people who have been, you know, parents who have been at home. So the idolization from the social distancing and being, you know, just kept inside and not being able to go out and do activities, but no one's really having a conversation about mental health, especially when we talk about government funding. There's funding for everything else related to COVID-19 as far as getting the vaccine out, and certainly that, you know, that may help. But what are some of the mental health policies that you would like to see addressed? Let's go with Dr. Michelle Lena.
Now, Andre, it's almost like, you know, mental health is minimized until something tragic happens. And then everybody kind of jumps on the bandwagon for a minute, checks in, and then checks back out because they try to find reasons. Oh, well, that just happened because of this, that, you know, that's not happening over here in my backyard. You know, so that's what tends to happen. Like I said before, I do think we're getting better. I do think we're becoming more consistent. But what I would like to see is us, you know, as I said before, normalizing the conversation. We need to, whether we're talking about adolescents or adults, we need to make sure we're not minimizing the toll that this pandemic has taken on people. Because what happens is, it's like people are saying, well, why do you need to go out and why do you need to do this? Because it's part of our mental health. It's part of how we manage. We don't manage in isolation. You know, we might think that we do until we're stuck in for so long. And then we realize how much we depend on, you know, that the social aspects of life. Even if you're an introvert, there's some part of you that needs, you know, that socialization. So I would like to see it normalized. I would like to see, as Nurse Charm said, you know, resources. And for, you know, a lot of times that means money also, you know, so people, no matter, you know, what your financial status is, your socioeconomic level is, you should be able to receive help, whether it's mental or physical, because you just shouldn't have to suffer because you don't have the money or because you don't have health insurance. So the more we normalize it, the more we realize that money has to be available. People don't need to be turned away. No, we don't have the long-term care facilities and anymore. And part of that is because, you know, we're trying to make sure people, even with severe mental illness, could participate in the community and not just be in that, you know, white room, as I said earlier, you know, not functioning and still able to socialize. So, you know, we don't have that, but that person should be able to see a therapist every day if need be. That person should be able to have access to medications. And I mean, that's probably another whole topic where people are not taking their medications because insurance stopped and they weren't able to afford, and for so many different reasons. So I think resources and just normalizing the conversation needs to come out of this.
Well, when it comes to outcomes, what would you like to see, registered nurse Crystal Brooks? Because you know what, when it comes to mental health policy reform, many of the issues that are not being addressed when it comes to mental illness and the funding for it. Many physicians on the front lines are seeing the effects. And has it been the case for you as a registered nurse working in a healthcare setting that issues that go undressed when it comes to mental illness, you see them?
Absolutely. Mental health and dealing with, dealing with this particular vulnerable population, I have seen those issues. And what I would like to see addressed and changed is that I would like to see funding. As Dr. Leno said, I would like to see more funding to help out with the mental health population, for resources that they can have what they need, because there is a lack. As a mental health leader, I have seen more than any area of nursing that I have been in, where the actual providers get together with their own resources to help the mental health population. With clothing, with food, with shelter. I mean, I have seen that, Christmas time. I've seen, you know, us, giving the mental health community hats, gloves, scarves, just things that we take for granted they don't have. So, like, I would like to really see more funding and more support when it comes to the mental health community. I really would.
Well, let me ask this question, because I know you brought up you used two different terms: mental health population and mental health community. And to the layperson, a mental health person and what they're going through can be visible, but quite frankly, anyone could have a mental health issue. I mean, I could have a mental health issue, and you may not know it, but COVID-19 has highlighted that, heck, we all can have some type of mental health issue, such as dealing with anxiety and depression and being enclosed in your home 24/7. That it's really not should it be seen as a certain segment of a community, or just really a more broadened approach that we should take, that look, anyone can have a mental health issue?
I believe, yes, anyone can have mental health issues, whether it be temporary or whether it's a permanent situation. Absolutely, especially with COVID-19 in this new pandemic. And I think
Right.
that with that, it's an acute or a chronic mental health issue, I think it's important for us to reach out to those individuals and give them the resources that they need, or connect them to the resources that they need. And I also feel that it's important for the person, if they're able and capable, to reach out to the providers, or or someone, family members, because there is help out there. I would like more help, but there are resources out there for those anxiety issues and things like that, counseling sessions and whatnot. So if individuals then could just reach out to the providers, and just let us know that you having some of these issues, please don't be embarrassed about it, because I have witnessed that as well, based off of a status or something. Some people may be embarrassed to say, well, I have a little bit of anxiety. I lost my my family member to COVID, and all of this COVID stuff going on around here, and I have so much anxiety. There's nothing wrong with reaching out to your health provider and letting them know that, and getting some help for that, whether it be counseling or whatever. There is help out there for it. So I think that awareness is very, very important.
And certainly, whether it's speaking or having a conversation with Dr. Michelle Leno, or our registered nurse Crystal Brooks, or Nurse Charms. I know you're always top of the line when it comes to research and having information as well. But sometimes, all we need is maybe some relaxation and a massage as well. And we know you know something about giving a massage.
Yeah. Wait, what was that last part you said? I'm sorry, the connection.
No,
What did you say about
saying
massage?
I was saying that look, sometimes all it takes for some relaxation and a massage, and we know you know something about that.
Oh yeah, absolutely. Everyone can hit me up. Gold Standard Massage. My business. I'm helping the community out. Before all this COVID stuff, but as we get towards normalization, living our lives with the potential risk of exposure, it's still available to continue massage. And we all know that massage is one of the number one ways that you can, reduce stress in your lives. Even physicians, they've come to a point where they may, they're recommending meds and get a massage. There's so many, Dr. Lino talked about, holistic medicine. Massage definitely is holistic medicine. So, hit me up, Go Standard Massage Clinic. But yes,
Yeah.
absolutely
Look,
massage.
let me tell you about it. I was getting a massage almost once a month before this pandemic hit, and yes, certainly relaxation of the mind and the body, holistic health, all that I'm sure has something good and beneficial towards our mental health as well. Well, I want to thank everybody for joining us tonight. For those who've been watching and listening online through the YouTube channel of Nurse Charms Live, I've been your moderator, Andre Ash. It's been great to have all of our panel guests join us tonight. Registered nurse Crystal Brooks, we thank you for joining us, and also Dr. Michelle Lino. And before we leave, we also want to give our panel of expert guests the moment to tell us where they can be reached for anyone who wants to contact them by phone, email, and also online on social media. Let's go ahead with Dr. Michelle Lino.
Well, I do have a website, dmlpsych.com. That's dmlpsych.com. And then on social media, Facebook and Instagram at My Matters with Dr. Michelle. Again, you can also see me Saturday mornings at 11:30 a.m. on TV 20.
All right, and let's go to registered nurse Crystal Brooks.
I can be reached through Facebook and also through Instagram, Compassionate Care Network. That is Compassionate Care Network Services. God bless you.
All right, and I think we all know where we can reach Nurse Charms, but Nurse Charms, thank you so much for bringing this platform to us, our virtual symposium on mental health and its impact on African Americans. I've been moderator, Andre Ash. Nurse Charms, take it away.
Yes, thank you all again. This is just amazing. It just gives me goosebumps. I'm excited. I love all things, medicine, all things mental health. So this is great. This is a much needed discussion. Thank you, Dr. Lino. Thank you, Nurse Brooks, and absolutely thank you, Andre Ash. Just want to tell everybody you can reach me. Nurse Charms, I'm on Facebook, Nurse Charms, I'm on Instagram, Nurse Charms, I'm on Twitter, Nurse Charms, and YouTube, Nurse Charms. Keep it all uniform. Excuse me. In History Month, I'm rocking my can y'all see it? And this is from my clothing line, Pure Apparel. So if you want to pick merchandise, you can go on mypureapparel.com and check out all of our merchandise that we have there. And again, just everyone, and continue to just, if you know anyone experiencing any mental health, definitely, turn them over to any of us on the panel. We'll definitely get them the resources that they need and point them in the right direction. So with that, everyone, good night.